Hi, everyone. Thank you for joining us today. You are joining the Center for Applied Linguistics. All right, let's get started. Hello, and welcome to you all. Thank you for joining the Center for Applied Linguistics today for this 30-minute webinar in our Critical Conversations Research to Policy and Practice series. We explore what it means to take an asset-based approach when working with multilingual learners and how an equity perspective can and must guide local, state, and national policy across different educational settings. Today's webinar is entitled The Path to Language Justice, a conversation on the strategic role of plain language. This webinar is being recorded and will be posted onto cal.org after this event concludes. Also, there is closed captioning available for this website. Press the closed caption button at the bottom of your screen and you turn it on. The Center for Applied Linguistics is providing this event as a public service. However, the views, thoughts, and opinions expressed belong solely to the persons expressing them and do not necessarily represent the views of the Center for Applied Linguistics. We are joined today by esteemed experts in their field who work at the intersection of research policy and practice in language education, language access, and equity. We are very lucky to have so much knowledge on one call, and we encourage you, the audience, to ask us questions via the Q&A box below. We will address as many questions as we can at the end of our discussion today. Also, you may click on the chat button at the bottom of your screen at any time to share your thoughts and comments. Try it now. Tell us where you're calling from. Finally, before we begin, please be sure to mute your microphone now to avoid any interruptions during the presentation. Today, we have Theodore Moore. Theodore Moore is a Vice President of Policy at NYIC. He brings over 15 years of nonprofit and political advocacy experience, having previously worked as a senior policy analyst for NYC Council Speaker Melissa Mark. We also have with us today Maricel G. Santos. She is Professor of English at San Francisco State University, where she teaches in the MA in TESOL and EDD in Educational Leadership Programs. We also have Leslie Fink. Leslie is a research assistant in the Language Assessment Division at Cal. She works on a variety of projects, including adult and K-12 ELL assessment, development, world language standard research, and communications. We also have Anthony Tassi, who is Chief Executive Officer at Literacy Partners NYC, an organization devoted to improving literacy and language skills of immigrant and low-income parents of young children. So we thank you for joining us today to talk about this important topic. Okay, we only have 30 minutes, so let's get right to it.
Thank you so much, Althea. All right, so I will open the floor with questions to our two experts, our immigrant advocate, Theodore Moore from the New York Immigration Coalition, and English professor Maricel Santos. We're so excited to be putting them in conversation with each other and with you. So my first question is, what is the state of the art from your vantage point? Are we still working on language access, or have we moved on to the deeper work of language justice? And what do you envision when you hear those words, language justice? Maricel, would you like to start us off?
Thanks, Leslie. And I just wanted to quickly thank Anthony and Althea and Leslie and Theo for letting me be part of this gathering this afternoon. So my perspective as somebody who works in adult education, works with adult English teachers, most of what I think about when I hear the word language access comes straight from the classroom, because our daily business is making language accessible. That is the practice and art of our work. But I think this is a sobering question as we try to imagine life after the pandemic, and it's not over. And as we think about splashed across the news, all the disparities that have been borne out in different linguistically minoritized groups, which makes us believe where have we gone wrong in making language access a reality. The reality is that there's laws on the books and regulations that are out there that should be enforced, and yet we have a very difficult time equitably enforcing them. But you asked me, what do I think about when I hear this word language access? I think you're going to hear many versions of what access means. I typically think of this as, the health communication filling up our newspapers, radio waves, social media platforms as we tried to make our way through a pandemic. Do I understand it? Is it in a language I understand? Because I really need to know, what I need to do to keep safe during this pandemic. That's only part of the equation, right? Language access in the literature, you should also look up language acceptance. Access via language is only as realizable if we don't have it accompanied by a broader construct of, are the languages that people are trying to communicate, build trust in with their providers and their clinicians, is the language that they choose to express pain and grief and worry. Is that an acceptable route? To go back to the classroom, I think we think about lots of languages being at our disposal when we are trying to build comprehension, when we are trying to build meaning. And I know we'll come back to this, Anthony. I think this is a point of discussion. Are we promoting access, comprehension, or are we promoting acceptance and self-advocacy and trust, which is mediated in multiple languages? So I keep thinking that we're still trying to understand the disparities at the root of inequitable access before we can imagine what linguistic justice is going to look like, what language justice is going to look like. But we also have a lot of good regulations that, if put into place equitably, we might imagine what that might look like. And I'll just say one more point. I think the language access movement has made us think about what's going on in interpretation, when right now we are communicating in so many different modalities, expecting people to communicate and understand one another in lots of different platforms, that it's no longer about the printed word or just orally. It's all forms of communication. And that is asking us to think, what is our definition of language? So there's a foundational question here that I think unfortunately, it may tire some of us, but still needs to get revisited.
Thank you for that multi-layered perspective, Maricel. I'll turn it over now to Theo. What is the state of the art in language access and language justice from your perspective?
So I come to it more from a policy perspective, really looking at the policies and laws that are in place, in municipalities around the country. And I think we've seen language access policies being passed to say that, language access or basic access to services that people need to, go about their lives, whether it's language access in schools, K through 12 or in higher education, whether you need language access to apply for housing or receive food subsidies or anything like that. Just going to the post office or the DMV, what languages are offered. I think we've seen vast improvement in that across the country, especially when you're talking about the top languages that are spoken in the country. So when you think about, other than English, Spanish, French, Haitian Creole, and other languages, Chinese, we've seen a vast increase in coverage in those languages across the country. But then when I think about one, situational language access, and two, the expansion of languages to languages beyond, I'd say like the top 5 that are spoken, I'd say we still have a lot of work to do. We definitely saw that here in New York. When the pandemic first started, we saw immediately the lack of language access coming across the board, where we were calling hospitals, and we actually called hospitals all across the state just trying to get services or information in any language other than English. And in New York State, that was extremely difficult. We recently did a survey, and we're going to be putting out a report specifically about the Nassau County Police Department, where we had individuals calling the police department, various precincts along Nassau County. Nassau County is on Long Island, which is right outside of New York City, calling police departments just to get, basic assistance from the police precincts. And just about 50% of the time, we couldn't even get language services in Spanish. About 50% of the time when we called these police precincts, we couldn't get any services. And this is for a county in New York State that has had a language access policy in place since 2013. And this is where we start to talk about language justice. So we have a lot of language access policies, but we're not seeing proper implementation. When we're passing policies, when policies are put into place and laws are passed, we're not seeing money put behind these policies. We're not seeing, training being, standardized across the board when we're implementing these policies. We're not seeing any sort of enforcement measures put into these policies. So while we're seeing expanded language access, we're very far away from language justice. And when I think about, the current situation that we're looking at, with recent arrivals coming to New York and to other places from around the country, obviously folks know the governor of Texas and the governor of Arizona, in a pure political ploy, has started busing individuals who were released from detention at the border to busing them to DC, and has now started directly busing them to New York City. We're actually anticipating 400 individuals coming to New York City on Thursday morning. And we've been seeing bus loads of individuals coming over the past couple of weeks. Now, we see these individuals coming, and we have to think about, what services they are going to need. Obviously, we're seeing a lot of folks coming from Central America, but we're not just seeing individuals who are speaking Spanish. And we have to think about how expansive we can get, because now we're seeing people coming from Central and South America who are speaking indigenous languages. So we have to think about, indigenous Latinx languages that are spoken and how these people are going to receive services. When we're seeing people come from the African continent, when we're seeing folks coming from South Asia, we have to think about all of these languages of limited diffusion that individuals are speaking, but the services are not really available in any of these languages, which means that individuals, especially, young people in the family, are doing, non-traditional ad hoc translation, which means, you'll have a son or a daughter going to a doctor, with their mother and having to hear all of this sensitive information just because that hospital or that doctor is not, really offering services. So, we're seeing, like I said, we're seeing expanded language access across the country, but we're not seeing expansion to languages for recent arrivals to New York and to other places around the country. And we're not seeing, the real robust services, and we're not seeing implementation of policies that have been in place, for years.
All right, thank you for that very in-depth discussion of both where we've gone right and what we still have left to do. So I'm going to reframe my second question a little bit and say, in your experience, can you tell me about an institution that does this well and takes into consideration the languages and cultures of the families they serve? If you haven't seen this before, what could it look like where their perspectives are really driving communications and other practices at such an institution? Theo, would you like to start us off for this question?
I wish I can say that there was an institution that was modeling, perfect, ways to really think about not just language and interpretation and translation, but really the cultural competency that is necessary when providing services. Because quite frankly, I think not only would I take that model and then apply it to as many places as possible, but I'm sure, the hundreds of people, on this call from around the country would do the same. I think we're still looking for that model and an institution that is doing it exactly right. I think there are places where they are doing great work. I know we have an education team here at the New York Immigration Coalition, and they're always talking about, cultural competency in public schools and throughout the education sphere. Definitely thinking about that in health and in medicine. But I do think there are institutions that are starting to do some proper things to really reach populations and thinking about how to provide services in a robust way. I'm thinking about, the community legal interpreter bank that exists in Washington, D.C. is a really good example of really using the folks who have language skills in the region to not only provide economic stability to individuals because it is a source of income, but also using those individuals to help do legal interpretation and translation in and around the District of Columbia. This is something that we're looking to model and create in New York City, to have an interpreter bank in New York City. I think a lot of about the language cooperatives that have been popping up all around the country, and really how they are, one, just serving multiple needs, so not only providing, entrepreneurship for a lot of immigrants in the United States, but also really providing a service and taking this, really non-traditional translation that happens, amongst family, and actually offering an opportunity for people to actually turn that into businesses.
Thank you. And I appreciated the point you made about not only language skills, but also cultural competence and the key skill there for providers. All right, Maricel, what is your perspective on institutions that model this well and take into consideration the languages and cultures?
Thank you for that. I work in classrooms, and it's really hard to imagine sometimes in levels higher up in institutions and say there's a nice trickle down effect here, because you hear about more access problems when you talk to your learners, or shoulda, coulda, woulda. I wish it could be easier. I wish it wasn't so hard. But I do know what I would tell the NIH, the National Institutes of Health, if they want to see a next 10 years of different solutions, invest in every single applied linguistics graduate training program to partner with you. As it's terrible, this laundry list that Theo has given us. And the thing is, most of the things he's talking about that we're struggling with are enforceable regulations. But there's also a greater understanding needed around what do we mean by language access, and getting beyond like, oh, I did it in Spanish, check, we're done. Either we did it in a brochure, or we have that one person on staff. A sociolinguistic understanding of language and healthcare would invite so many curiosities around, what colloquial variety of Spanish is better to hear a terrible diagnosis in, or that you want to express pain. I mean, look up the research on pain. It is one of the most difficult things to communicate in another language that you are not very versed in, which is why they created the pain scale, which they created a visual so you could point. But even so, there's some things that can only be evoked through language. And I'm sure the thing that I'm saying makes health insurance companies very, very nervous, because what I'm talking about will extend the doctor's appointment, will extend the level of investment you need into the relationship between a clinician and a patient. But that's what we know from language use. Language for meaning, language for communicative purposes requires that you get more than one chance to get it right. And it's not just, the provision of a single brochure, or the provision of somebody who's able to just translate something from one language into the other. I just want to bring up an example. The work of Glenn Martinez did studies of Spanish-English use, bilingual translation in Texas, and found that somebody who asked for Spanish support was provided Spanish support, then would get shown a stack of information because they're about to have surgery or an important procedure, and then was given a very short verbal translation. Now, one on the checklist, check the boxes off. Language access was provided, somebody who spoke the target language was provided, but the patient left the encounter and said, there is no way that I am fully informed. And so Glenn talks about it as the delitterization of Spanish. That to me is such a powerful construct because it opens you up to this is sociolinguistics on full display, that we need a greater curiosity about language for what purpose, between what set of speakers and hearers, what kind of healthcare exchange is happening. But we should be able to put our brains together. I mean, there are too many smart applied linguists on this call. There are too many really well-intended clinicians out there, but we only have part of the iceberg. NIH, invest in applied linguistics. We would love your monies. It's probably that's not the most. I'm probably not going to ever get another grant. That was like a really poor way to sell my. But all the graduate students here can take that mantle up.
Maricel and Theodore, I'm really loving this conversation, and I'm loving who's here too. I've just been, as you're talking, I'm watching the chat just blowing up with amazing perspective, and I see a lot of friends here, a lot of people that have come up through the plain language movement. So I want to take maybe a step back and ask you, and I'll toss this to you, Maricel, first. Like, is plain language is plain language really a building block here? Is it really? Do you think like it's something, given the history across the sectors of our society, given the mandates, given the practices, do you see it as a building block here, as a strategy to get us to where you want us to go?
Without question. Nothing that I'm saying today discounts the power of the plain language movement. The fact is, it's never enough, because I'll just talk as a teacher. It's not like I come up with a lesson plan and said, oh, yep, I figured out that handout. I used the right words, and this lesson plan is rock solid. No, there's always an interactional in the moment. You have to adjust your comprehension or adjust your communication to ensure that somebody is comprehending. And again, this idea of giving yourself more than one chance to get it right. I just love the idea that we've inherited from all the Vygotskian thinkers, that it's about language amplification, that it's about scaffolding. I mean, wouldn't it be cool if instead of we called it the plain language movement, we said, we're not trying to simplify life for you. You actually want accurate information when you're sick and have to have a serious diagnosis. There's something about knowing the parts of the body and how they intricately and accurately work together that gives you confidence that you're going to get better. I'm not saying that jargon is always worthwhile, but some of the best practices are things like say sodium, but then explain sodium means salt, so that you have, again, 2 chances of getting it right. If you knew sodium, great. But if you don't, at least you have a second chance of getting it right. So it's not that we didn't get it right with the plain language, is that we communicate in so many different ways now. I mean, just ask yourself, how do you truly understand COVID? It was partly visual. When you saw like the scary thing, the scary red bumpy thing, and then flatten the curve, when you saw that interactive diagram, and it wasn't a paragraph you read or had translated for you. It was also part of your social networks that reinforced what you were understanding. So again, it's not that plain language is wrong. It turned the mirror on ourselves. We said we need to make sure that we're being comprehensible, but then invest in the relationship so that you come across as a trusted person. And there's an educational piece to that on both sides of the equation, not just the learner side.
Yeah. Theodore, do you want to come in on this?
I mean, I think, the reason that, things in the health field, in the medical field, in the legal field, even when you're looking at laws that really guide how we move about, on a regular basis, were, since the founding of this country, were intentionally written in a way so that only the elite could really comprehend what was going on. So that was very specific, like they don't want you to understand the way that laws are written, because if you understand the way that laws are written, you, one, would probably want to change way more laws than we're currently trying to change, but then you would be able to act accordingly. And we know, there is, since the founding of this country, a system to lock people up so that there's a continual hierarchy that exists. So when we're trying to create plain language, like we're not actually thinking about, it goes beyond immigration, it goes beyond, non-English speakers. It's really just about comprehending everything that affects your daily life. And I think, since, for the last, I'd say, 10, 15 years, thinking about merging plain language and how that affects, everyone, regardless of what language you speak, and language access and language justice. They've kind of been moving on like parallel paths, but really the movements haven't really, come on the same track. So I think, we've been primarily working, on language access and language justice, but haven't really, gotten around to think about, how can we just simplify things that are actually out there in the community. We think about it as an individual organization about how we can word things, on flyers and on our website so that people can easily comprehend it. But, overall, we see, we help pass laws that, quite frankly, even I can't read, and I help write some of them. So it's like, how do we actually merge these two extremely important movements so that we can get to the place where everyone can access information, regardless of your background or education history.
Yeah. Well, Theodore, you've done extraordinary work to get the people of New York and our political system and our social services system to that place. So just as a New Yorker, I want to thank you for that. And I want to just ask one last question. I'm so sorry we don't have more time. What a brilliant conversation this is between two brilliant people I admire so much. But the question is, what's the call to action? So you have 265 people here. You're never going to find a better group of 265 people. What's your call to action for this group and the thousands more that are going to watch it online? And what's your personal call to action? You only have a minute each for your answers. So Theodore, you want to go first?
Well, I didn't know that many people were watching, and now I'm a little nervous. I thought it was just like the five of us just having like an off-the-cuff conversation. So now I'm gonna stutter for the next 15 seconds and then not have any time left. I think it would start with figuring out, what your local or statewide language access policy is, and then immediately trying to improve it. I think there's extremely good models that do exist in the language access and expansion sphere that people can really model. So like, like I said, Washington, D.C. has a strong policy that actually has enforcement measures. California has a strong policy. New York State in the past, a year and a half has more than doubled the languages that are covered and has a really strong piece of legislation that has been introduced in both houses and has passed our state Senate, the past 2 years in a row. So there's actually models on expanding language access that I would say people could start with. So first, figure out what your actual policies are, and then find a better version, and then actually look to enact it.
I'll just go really quickly because I bet that there are professors and in grad programs or undergraduate programs and students here. We have lessons to be learned from COVID. So go find a small intramural grant, only has to be $1,000. Go buy pizza for your local community clinic or the professors in medical schools. Sit down and talk to each other about what we learned about language access over the past 3 years. And then write it up in an op-ed, write it up in journal articles, blog it, come back to Cal and share your insights. So much is slipping out of our grasp because we're not taking time to learn about the experience of so many linguistic groups in this country, all the way down to the less heralded groups that Theo was talking about before. All those experiences matter. And I'm sure there are lots of people on this call who can make a difference in this regard.
And I'll show up if there's free pizza.
Me too.
This has been an awesome conversation, so informative, and we've got lots of questions in the chat. However, we are out of time. It is now 4:30 p.m. Anthony, did you want to take that one Q&A question really quickly, or?
Which one did you mean, Althea? What's your?
Can you please elaborate more on cultural competence?
Cultural competence, who wants to take this?
Quickly. So I think there's a lot to think about, beyond language. There's, tradition, there's the way that people use language. So when you're thinking about translation and interpretation, so you may have, someone from the Dominican Republic and someone from, as close as Puerto Rico, and they may say the same word, but it means two different things. And you really have to understand what is happening, where they're from to really apply that to the services that you actually provide. That's like a quick, short answer, and I could go really far, but time's up.
All right, thank you so much. Thank you guys all for joining. We appreciate it. Please watch your emails for the recording and a survey. Thank you so much for joining Center for Applied Linguistics. We look forward to seeing you at the next one. Bye, everyone.
Bye, everybody. Ciao.
Bye-bye.